C.P.P President Edith Kawala, as she tells us more in the following excerpt.
Been stolen from the Cameroonian people. The Cameroonian people, people have died. Cameroonians died because there was no oxygen, because there was no personal protective equipment, because tests were not available. Cameroonians died, and therefore the International Monetary Fund, from which this money was taken as a loan, which has to be repaid, cannot give a new loan to Cameroon when we have not established who stole that money, why procedures were not respected, financial management procedures were not respected, and how they will be respected in the future, so that loans taken in the name of Cameroonians are actually used for the well-being of Cameroonians.
Now in health, we observe that there has been an increase in the number of children born with clubfoot malformation, and thus the need for more sensitization for parents in order for them to get help on time to assist these children. This was the center of discussions today at the Baptist Hospital in Bopi in Douala, where parents were brought together and sensitized on this condition and how to go about it. Let's get more of this with Mange Venasius.
It is a rare congenital anomaly, a defect in which a newborn's feet or foot is twisted out of shape or position, often so severely that the bottom of the foot faces sideways or even upward. This is known as clubfoot. Given that it is a deformity from birth, medics say the situation could be corrected if detected and treated early. It is on this count that the Cameroon Clubfoot Care Project has embarked on a sensitization campaign to create awareness on this congenital malformation that is increasingly present in our country.
Clubfoot is a common deformity in childbirth, and in Cameroon it is estimated that over 1,000 children are born each year with clubfoot, and out of this 1,000, only about 20% are enrolled in treatment because many don't have access to these treatment sites.
And so there is a need for parents and society at large to be aware that the situation can be reversed through treatment.
Beginning 2014, we have enrolled over 1,400 children, and 500 of them have completed their treatment, and they are not doing follow-up. They are fine and their legs are okay. They are doing like other children.
Although the situation may be beyond the parent, but there is lack of infrastructure to take care of children born with such malformations.
There is a greater percentage of the children who are born in Cameroon with clubfoot who don't still have access to treatment, because there are other regions in Cameroon that they don't have the approved clinics or personnel to do it. The south, there are not clubfoot clinics in the south. In the east, there are no clubfoot clinics in the east. Then there is only one in the Adamawa.
With advancement in science and technology, the treatment process, if started earlier, is quite simple.
A child who is identified early with clubfoot just after birth, that treatment can be started even in the first month. By the time the child reaches the age of 3 months, we have already completed the corrective phase. That means the casting and the tenotomy has been done, and the child now is with braces. But the child has to continue follow up with us on regular basis till the child is at the age of 4 or 5.
Although correction is possible, parents of such children are advised to do a follow-up to avert a possible relapse as the child grows up. This will be a living example to say that clubfoot is not and should not be a stigma, neither for the child nor the family. The issue at stake remains ensuring that all children born with clubfoot receive early treatment, for if not treated, can cause severe disability.
Over in the east region of Cameroon, and notably in the town of Bertoua, inhabitants and particularly the road users are still filled with joy after the council installed traffic lights to control circulation, that is road circulation, within the town. This comes after Bertoua has suffered numerous road accidents as a result of the lack of this important road safety element. Let's get more of this story in the following report with Ekokobe Remy Carol.
The town of Bertoua is slowly moving towards the path of modernization in the domain of road circulation. This is seen as the council of Bertoua recently proceeded with the installation of traffic lights in prominent crossroads of the town.
It is important to say that this is the first time in this region that these traffic lights have been put on the streets. You see that it's an innovation that will need a period of time to sensitize the road users.
The road users are relieved with this innovation as they lament that they have been witnessing numerous road accidents due to the lack of traffic lights in Bertoua.
With the installation of these traffic lights, accidents on the roads will surely decrease and cars will easily circulate.
Seeing the actual situation of the National Electricity Supply Company with its incapacity to offer energy supply 24 hours a day, the Bertoua Council has opted for a solar power plate to fuel the traffic lights in the town. The installation brought about a widespread of joy to the inhabitants of the town.
And now on to the far north region of the country. The divisional officer of Mairie, that is in the Diamare division of that part of the country, has officially relaunched activities of the Subdivisional Development Committee. This was during a gathering that assembled sons and daughters of the soil, where a sum of 4 million francs CFA was raised to better up the functioning of this committee. Let's get more of this story with, once again, Ekokobe Remy Carol.
9 years after the development committee of the Mairie subdivision in the far north region withheld its activities, the divisional officer of that area held a massive gathering in the Douala locality to relaunch this committee. Difficulties faced by the population were tabled during this gathering, such as communication and road problems. With aims to restart the development activities, members of the bureau were newly installed to control happenings concerning the growth of this subdivision.
It is a good initiative. We want to thank all the contributors. We are very grateful for all donors, and we ask the population to work together with us in order to improve the living condition of our population.
An amount of more than 4 million francs was raised to begin with development activities. The divisional officer reminded the newly installed members of the committee to use the funds appropriately, and also called on the sons and daughters of this locality to continue with contributions so as to better develop their community. To spice up the gathering, entertaining activities like musical performances and cultural dances made the population happy. The new president of the committee, Joseph John Dauda, acknowledged that his biggest challenge is to see that this committee gets back to its feet.
In the National Assembly of Cameroon, members of the Social, Cultural and Family Affairs Unit have been meeting with officials from the Ministry of Arts and Culture in order to evaluate Cameroon's cultural policy and the organization of the arts and culture subsystem or subsector. The two-day conclave, which opens today in Yaoundé, notably at the National Museum, brought together MPs as well as cultural actors from across the board. Ate Bonaventure with details.
Les plus passionnés sont restés parce qu'ils savent qu'à la fin, c'est l'amour et l'art qui font les pays. Alors ils essaient et s'adaptent à chacune des circonstances.
Cameroon has a rich and diverse culture made up of a mix of more than 250 local languages and customs, which need to be developed and promoted for the growth of the country. The Social, Cultural and Family Affairs Commission of the National Assembly organized this two-day exchange at the National Museum to size up the contribution of the arts and cultural subsector in enhancing national growth.
In other countries, like our neighboring Nigeria, you take even the common artist in Nigeria is 10 times better than that of Cameroon. And their cultural industry has developed their country enormously. Why can't it be the same in Cameroon? So as MPs, we are going to join to see how we can take that forward.
It was an occasion to look into the problems plaguing the cultural industry in Cameroon in view of proposing adequate solutions for a more sustainable horizon.
We've learned a lot, and from this we will be able to see how we can help to plead for an increment or an increase in the budgetary allocation of the Ministry of Culture, because for us to achieve what we have to achieve, the budget of the Ministry of Culture has to go up.
The two-day event is marked by artistic display and exhibition of traditional instruments and artifacts that date centuries.
To round up with news out of the Cameroonian borders, Mali's interim president, Colonel Assimi Goïta, has appointed a new prime minister for the country in the person of Kogel Kokala Maïga. This comes in the wake of a political crisis. And out of the African continent, Iran's largest vessel has sunk at the Gulf of Oman after catching fire and leaving at least 33 people lightly or slightly wounded. Details of these stories in the following with Rogea Tububa.
With a new transitional government following the second coup in 9 months, Mali's interim president, Colonel Assimi Goïta, has named the country's new civilian minister. Shogel Kokala Maïga's appointment was widely expected. He led the 5 June rally of Patriotic Forces movement that took part in the overthrow of former President Ibrahim Boubacar Keïta last year. There has been support among some civilians for the new coup on May 24th. Goïta declared the new prime minister will carry out a broad consultation between the different sectors. At the crisis summit in Ghana, the Economic Community of West African States, ECOWAS, decided to suspend Mali from the 15-nation bloc and urged Goïta to appoint a new civilian premier and build a new inclusive government. International pressure is mounting. The African Union and the West African Bloc, ECOWAS, have both suspended Mali and called for a return to civilian rule. The African Union warned that if the military do not hand back power to civilian transitional leaders, the Council will not hesitate to impose targeted sanctions and other punitive measures. One of Iran's largest vessels has sunk after catching fire in the Gulf of Oman under unclear circumstances. Despite 20 hours of all-out efforts by civilian and naval military rescue teams, the rescue operation of the CAC training support vessel was ineffective due to the spread of fire in different parts. The ship had been deployed to international waters to participate in a training exercise when it caught fire near the port of Jask. According to the state news agency, the fire started in the engine room and caused parts of the ship to melt and fall into the sea. Nearly 400 crew members were evacuated safely from the ship, and 33 of them with minor injuries. The commander of the Navy and several senior officers were in the region to investigate the incident. The ship sinking follows a string of recent explosions and fires at nuclear and military sites. The Iranian Navy has experienced a spate of disasters in recent years. Last year, a missile mistakenly struck a naval vessel near the port of Jask during a training exercise, leaving behind 19 sailors dead and 15 others injured.
And that, of course, brings us to the end of tonight's edition of the news on DBS Television with me, Cynthia Nguemo. Thanks for watching and see you tomorrow.